Hello, everyone. Welcome to another review class for our LAM practitioners. Um, we shall start with the feeble or deficient pulses. And for today, we shall be focusing on deficient pulse, which is also known as shumai, or empty or vacuous pulse. So there are actually five deficient pulses. So we're starting with the deficient pulse. The deficient or depleted pulse, which is another name for the deficient pulse, is forceless, empty in all three depths, no? So this indicates a deficiency pattern. So it could be qi and blood deficiency. This is due to insufficient qi and blood, all kinds of deficiency of the Zangfu organs with depleted vessels. So this is also known as vacuous, depleted, or deficient. This is similar to the drum skin pulse. The empty pulse is superficial and wide, malawak, no? But the difference is that the empty pulse is not hard and the pulse is without force. The empty pulse's weakness reflects a shu condition. If the pulse is also rapid, so this is yin deficiency heat or empty yin deficiency with empty heat. This pulse can also be seen when there is jing deficiency or qi deficiency, or if a person has been invaded by exogenous summer heat that has injured the qinye and yin. If there is invasion of summer heat, the pulse will be rapid. Okay, so the patterns of imbalance of an empty pulse, puro deficiency, yin, blood, qi, qing. So if it is an empty and rapid pulse, so there is yin deficiency heat or summer heat. So again, the pulse shape is wide but without strength, forceless, all three positions, with either light or heavy pressure. There is a sense of emptiness, no? So the key points, malawak siya, wide, forceless, and slack. It's also called empty or vacuous. So let's look at the indication. So we all know that this is a deficiency syndrome. If the pulse is floating and deficient, so deficient siya tapos nagfo-float, that's chi deficiency. If it is submerged and deficient, that's internal deficiency. Choppy and deficient, that's blood deficiency. Rapid and deficient, yin deficiency. Slow and deficient, yang deficiency. If yang and qi are deficient, the pulse will be forceless. If yin and blood are deficient, the vessel will not fill up. So any deficiency may lead to a deficient pulse. So the deficient pulse may be at any position or depth. It may also be rapid or slow. The deficient pulse is also a group of pulses. They beat without strength and they indicate deficiency. Examples include ikagrupo niya to, frail, soggy, and faint pulses. So it's superficial, a pulse which feels floating and big or wide with slow beats but becomes obviously soft and deficient when slightly more pressure is applied. The empty and hollow pulses are both floating and big. Remember the hollow? But they differ from each other, should not be confused. Under stronger pressure, the empty or the deficient pulse feels soft and weak, malumanay, while the hollow pulse, when you apply stronger pressure, it feels floating and big. Like a spring onion, it feels empty and hollow at the center, but slightly fuller at the edge. That's for the hollow pulse. The empty pulse appears when the upright chi is damaged. So kaya deficient ka. After perspiration caused by unconsolidated weight qi, after palpitations caused by heart blood deficiency, or after fear or fright caused by heart shen deficiency. First, the upright qi is damaged, then symptoms will appear. During an attack of summer heat, body heat increases because the damage na yung yuan qi and the empty pulse appears so. To treat, benefit the qi and the summer heat will clear. Internal heat is also caused by yin deficiency. That means yin is unable to nourish the yang. To treat, nourish the yin, and the heat will decrease. Overall, blood deficiency or yang deficiency must be nourished, and qi deficiency must be benefited. The heart is in the upper heater end. When heart blood, nasa tune ano tayo ha, tune position. When heart blood is unable to provide nourishment, so of course the pulse will become empty at the tune. Okay, spleen and stomach, nasa middle heater. When you have food stagnation and stomach swelling caused by qi deficiency and loss of transforming function, there is empty pulse at the quan position. Both kidneys are in the lower heater. When numbness caused by steaming bone heat results from damaged qing and blood, the pulse becomes empty at both shear positions. Now let's go to assessment. Would you like to participate, Sir Jobel? Who would like to participate? Okay, kaya mo. Okay.
Yes,
I try.
I am. Yay.
Kaya yan. Okay. Okay, this pulse, you have to identify the pulse. Located superficially, it is clear. It clears with light pressure. So, it is clear pala with light pressure. Light lang clear siya. Pulse which indicates a latent pathogen, broadly speaking. It does not disintegrate with increased pressure. Hindi siya nawawala. It has the maximum amount of sensation at the superficial level. The body has mobilized its chi. It happens when there is invasion. What do you call this pulse?
Look is superficial. Low light pressure. Pulse
Floating
will
or
indicate.
superficial pulse?
Speaking is the same.
Okay, number two. What do you call this pulse? Superficial, irregular, forceless, rootless pulse, indicating chi exhaustion of the organs.
Superficial.
Okay, Mom Tricks, can you help?
Scattered.
Scattered. Okay. Hollow, large, but empty in the center. Okay. Parang onion. Empty, empty in the center. Loss of blood and yin. There is bleeding somewhere, not menstruation. What is this pulse?
Blood deficiency. Yin deficiency.
No, you have to tell me what kind of pulse.
Pulse.
What's the pulse? Mom Tricks.
Hollow.
Hollow. Mm.
Ah,
Andiyan na nga yung hollow o or rare. Okay, this is shumai, where it feels like a leather has been stretched over a drum. So yan, given na yan. The vessel is stretched but still floating on top like a drum. It's empty leather. It's just at the top. Serious yin deficiency and vessel damage, hardness, severely pathological yin deficiency. I have encountered this kind of patient. What do you call this?
Drum skin.
Yeah, drum skin pulse. Diyan na yung drum, oh. Pulse that doesn't exceed 12 beats of amplitude, deep pulse, easy to feel, but can only feel at 12 beats. Located, deep, palpable with heavy pressure. So that means you can only palpate this when you apply heavy pressure. It indicates interior excess or interior deficiency syndrome.
Deep
Deep
pulse.
pulse, yeah. Difficult to feel, nagtatago, requiring heavy pressure. There is extreme stagnation or critical conditions. Parang feeling mo, parang bakit parang nawawag, parang wala. What's the English for nagtatago?
Hidden.
Then pulse.
Hidden pulse.
Okay.
Hidden.
Deep, excessive, string taut, and long pulse, indicating internal cold, hernia, or masses. Matigas siya.
Empty pulse.
What's your
Hidden.
answer?
Hidden.
Em-
Ay,
Hindi,
Empty pulse.
Kita-kita na nga, deep, excessive.
Mali ah.
Deep and excessive.
Internal cold, hernia, masses. Long, string taut. It's a firm pulse. Hindi pa natin yun. Indicates internal cold, hernia, or abdominal masses. It is present when yang qi is submerged by interior cold.
Firm.
Yeah,
Pulse.
it's the same pulse.
Firm.
A pulse rate of less than 4 beats per breath or less than 60 per minute, indicating cold syndrome. Excessive cold manifests as slow, forceful pulse. Deficiency cold manifests as slow, weak pulse. So anong klaseng
Choppy. Slow weak
Firm.
pulse or choppy.
slow pulse?
Slow pulse.
And the last one, pulse beating at 4 beats per breath, indicating dampness or weakness of the spleen and the stomach. It is present when sticky dampness obstructs the flow of qi.
In
Slow. Slow
Moderate,
pulse.
moderate,
moderate
pulse.
pulse.
Moderate.
Moderate yung
Wait.
4. Hmm? Hindi mo siya less than
Moderate.
4 eh. So moderate siya. Wow, thank you so much for
Thank
joining.
you, Doc.
Thanks, Doc.